Hello my dear students, and in this tutorial video we are going to discuss the way how to write a case history, which is going to be the action of your studential work at the end of the semester on the course of general surgery. So, case history may be the most dramatic part of learning a clinical subject within the senior course of surgery. So, as we are learning general surgery, it seems to me that the most familiar way to find out about the subject of surgery and the clinical aspect of general surgery is to write case history about one of the most common surgical disease. So, one of the most common surgical disease in your practice is going to be the acute appendicitis. So, it appears to me that it could be a great opportunity for all of us to study this pathology in the case of academic case history. So, without further introduction, let us begin. So, what we are about to do in our course is called the academic case history. Academic case history means that we're going to investigate our patient academically. It means we're going to go through those aspects which are not included in general case history, which you are going to perform and write when you will be, if someone of you will be senior surgeons or surgeons. But still, the point of our action is to give you the main understanding of what is it about to make a case history of a surgical patient. So, let us begin. First, a little overview. What you are going to do. Each one of you, each student of every group, you're going to write your own case history. It means that I'm going to give you a case of a surgical disease, and you will have to write from your hand all the way a case history for each and every patient you imagine. But I clearly understand that this is a very hard task. This is one of the hard tasks which imprises the student of a third course. So that is why I wish to give you a very extensive tip on how to write a patient's case history. That is why I clearly desire to become one of you. I want to remember my surgical youth, my studential youth, and I want to write a case history with you all the way. So, without further introduction, let us start. Okay, so the case history starts with the title page. The title page has the name of your institution. It is the Institute of Biology and Medicine of Taras Shevchenko, National University of Kiev, Department of, here we all with you write, General Surgery. Oh, it's English. General Surgery. So, Chief of Department, that's what goes next. Chief of Department is Professor M. Khorobeiko PhD, MD, assistant professor. So assistant professor, that happens to be me, and my name is Dmitro Makhmudov, and I'm an MD. So case history, surname. At the beginning of the case history, you fill in the surname, first name of the patient. You can figure out any name, surname of a patient to your choice. It doesn't matter. So let it be John Smith. John Smith. Principal diagnosis. So, as we are writing an academic case history of a surgical patient, we're going to talk about one of the most common surgical diseases in surgical clinic, which is acute appendicitis. So, that's what we write in the in this line, the principal diagnosis. It's acute appendicitis. Complications. Well, virtually regarding all the surgical practice, maybe all of acute appendicitis are complicated with local serous peritonitis. So that's what we write in the complication section. So it goes local, serous, peritonitis. Concomitant disease. Well, although a lot of patients which present with acute appendicitis are of almost young age, but still all of those patients, they have in common the chronic gastroduodenitis, because they are above age of 18 and they are urban citizens. So we can write without second notice that their concomitant disease is chronic gastroenteritis. Chronic gastroenteritis. In next section, right here, the curator, it's you, it's a particular student which is going to write his own case history. So in this section, the curator, you write your own name. So as I'm going to path all this way of writing a case history with you, that is why in this particular tutorial video I'm going to write down my own name. So my name is Dmitro Makhmudov. Dmitro Makhmudov. But further on you write your course, faculty and number of group. Here after the name you write your course. You are a third course student. Then your faculty and the number of your group and the full student name. For example, I write down my own name is Dmitro Makhmudov, and in the final you write Kiev 2020. That's because we are writing down this case history in Kiev, and this is the year 2020 when we complete this case history. So let's do the summary once again. First thing you write is the name of your institution. This is the ESC, Institute of Biology and Medicine of Taras Shevchenko, National University of Kiev, Department of General Surgery. This is the name of the department. Then the chief of department is Maxim Horobeiko. He's the MD, PhD, and professor of surgery. This is his full name and academic title. Then your teacher is assistant professor Dr. Dmitro Makhmudov, MD. This is his academic title. Then the case history of a patient. You think of his name, whatever comes to your mind. Then the principal diagnosis, leave this field blank for you because each group will have his specific disease, which we're going to talk about. Complication, also leave this field blank because I'm going to give you the specific complication for this particular patient. Concomitant disease, chronic gastroenteritis. You can leave this field because absolutely all adult patients who underwent gastroenteroscopy even once throughout their lives, they have chronic gastroenteritis. So the curator field, which is situated in the right bottom field of the page, you write on your own name, not this is particularly my name, so you change it to your name because it's your case history which is going to be written. You write down your name, course, and group, so I could know that this is particularly you and nobody else. You write down your full name, full student's name, and in the end you write Kiev 2020 because we are now in Kiev, and what we are doing is writing a case history in 2020 year. Month doesn't matter. So that is the title paper of a case history you are about to write. Please note it down, and if you do that, we proceed to another part of a case history, which I am going to discuss with you throughout our online class.